Hi, this is John Kanellopoulos here from our office in Athens, Greece, clinical professor of ophthalmology at NYU Medical School in New York City, New York. And it's really my pleasure to share with you some very fascinating technology. We're seeing here a schematic on how ray tracing works. It's all conducted by one device. It's called Sitemap by Alcon Wavelight, and it's in essence a pentacam HR axial length wave, and it creates a sine fluke image of the anterior part of the eye. And then with Hartmann-Shack, it images the retina and all the high order and low order aberrations of the eye. But more importantly, it's an interferometer as well. And it uses interferometry so we can create a 3D model of each given eye that's examined. And we'll see how this pans out in our presentation and the fascinating data we have in studying this technology in myopic LASIK. These are the first data available worldwide, and we're now very pleased to be part of an international multicenter study also valuing this technology. I hope you find this presentation interesting.
Hello, this is John Kanellopoulos, and on behalf of our associate, Dr. Vasilis Kouteris, and the LaserVision Clinical Research Institute in Athens, Greece, it's really a great pleasure to share with you these outstanding outcomes using a customized technique that is novel, ray tracing, optimization. The purpose was obviously, and I want to point out here that I do consult for Alcon, and this was a study sponsored by initiated trial by the investigator, which was myself, number 59917561 from Alcon, Greece. And we looked in the study the safety and efficacy of using this new ray tracing platform to customize myopic LASIK eyes. To note here that this technology does carry a CE mark since the fall of 2019. And in this particular study, we chose to study 25 consecutive patients, 50 eyes that were treated with femtosecond laser-assisted LASIK using the FS200 femtosecond laser and EX500 excimer laser by Wavelight Alcon. And the key element here is that we used a novel artificial intelligence platform that initially calculates the ablation profile based on the model eye of each eye, which is created by the interferometry length data. And then through wavefront and pentacam measurements, it does calculate low and high order aberrations by studying 2000 rays going towards the eye and from the eye on this theoretical 3D avatar eye model. So we looked at the usual visual acuity data, which were refractive error, uncorrected visual acuity, corrected visual acuity, keratometry, topography, tomography, high order aberrations, and contrastivity for a year. And just to backtrack here a little bit, we have introduced and reported subsequently how important in our clinical experience was adjusting the manifest cylinder in topography guided treatments with also Alcon's topo-guided Contour platform. We showed and published in 2016 that TMR data proved superior to those from topography guided treatments where the treatment was based on the manifest refraction from each patient. So we theorized that collecting all these data and manually calculating the cylinder to be treated gave an advantage in these eyes clinically, and this work appears validated by this new device. And here is the device called Sitemap. It's basically an Oculus axial length pentacam HR wavefront device, which is configured by the Alcon Wavelight team to collect these three measurements from each eye of each patient, interferometry data, sine fluke tomography, pentacam HR, and wavefront data using Hartmann-Shack concept. And you can see the report on the top left here on how these data are incorporated to produce the model. And the model of each eye is calculated on the top left. We can see the interferometry data that are used for the device to formulate a 3D model of each eye that it studies. Then on the top right, we're seeing consecutive pentacam measurements, and there's certain protocol on how similar and homogeneous these measurements need to be in order to be accepted as a go-to by the device, and so on with the wavefront measurements as well. And also during these measurements, iris recognition and pupillarimetry measurements are taken. We have a detailed tutorial on the YouTube portal that you can see here, and you're welcome to jot it down and visit it to a complicated concept. So just to summarize how automated ray tracing takes place, in the first step, as I mentioned, the actual length measurements produced by the same Sitemap device give the opportunity for the software to create a 3D model of each eye, an avatar eye, and then the tomography measurements with the pentacam are used to trace 2,000 rays from the device through the air, cornea, aqueous, and incident to the anterior surface of the lens of the eye. And then 2,000 rays are again measured in retrograde with the wavefront data from the retina through the vitreous cavity, incident in the posterior lenticular surface through the lens to the anterior lens surface. And these data are then coordinated to create high order, low order aberrations. So in low order, the amount of myopia and astigmatism, higher order aberrations, mainly coma and trifocal, and also the tilt between the cornea refractive surface and the lenticular refractive surface. And this is a key element to the concept, and thus is able to provide with very detailed data for aberrations. So to go to results, these are the best results we've yet to see in refractive surgery. And I mentioned before, these are 25 consecutive patients with myopia and myopic astigmatism of up to 8 diopters. The 3-month data, which were stable through 12 months, showed an average refractive error of about -5 with broad range, as you can see here, up to -8. And refractive astigmatism of average about -1, but with a broad range of up to 425. The refractive astigmatism was also studied in means of topography, the topographic objective astigmatism measured by the pentacam. And we saw that 65% of eyes gained at least 1 line of vision, and 38%, this is an astounding number, gained 2 lines of vision when comparing preoperative corrected visual acuity to postoperative uncorrected visual acuity 3 months, 6 months, and up to 12 months time. So the pre to postoperative higher aberration average had very little change, and this is again a new thing in refractive surgery, an increase of higher aberrations from 0.25 preoperatively to just 0.35, and this reflects in the contrast sensitivity data that you can see on the bottom right, the F image on the compiled refractive data, which show that the contrast sensitivity was actually improved postoperative than preoperative. Very, very impressive data. Right here, we report safe and effective preliminary outcomes using this novel excimer laser customization by ray tracing optimization with this Alcon Wavelight platform, using a configured device by Oculus and named Sitemap by the manufacturer, and the treatment is called Innovise. It is still under study in a multicenter trial in the US and international, and the preliminary data from those studies are very similar, and we're exploring all the possible promising possibilities in using this technology to treat quite irregular eyes such as keratoconus. We do have a case report that's being published in the Journal of Cornea, underlining how the use of this technology can overcome some of the hurdles in calculating total eye low order and higher order aberrations, even in very regular eyes such as keratoconic eyes, and also the possibility of combining it with cornea cross-linking. Thank you so much for following this very difficult project to describe, and this is John Kanellopoulos on behalf of Dr. Vasilis Kouteris and all our team here in Athens, Greece. I hope you enjoy your meeting. Thanks so much.